All right, welcome back to the deep dive. We've got quite a mix of sources in front of us today, all touching on healthcare in different ways.
That's right. It's quite a journey, actually. We're starting really big picture, looking at global bodies, setting quality standards. Then we zoom into a company that actually helps hospitals, meet those standards and just manage things day to day.
And then we bring it right down to something very personal, right?
Yeah.
That piece of advice about your own medical tests.
Exactly. Those results you get online sometimes.
So our mission today is really to pull out the key threads from all of this. We want to understand how these different levels connect, the huge systems, the hospital operations, and that crucial moment you're looking at your own health data.
Okay, so where should we start? Maybe with those big standard-setting organizations?
Sounds good. One name that really stands out in the materials is Joint Commission International, JCI. They're positioned as a major global player in healthcare quality and patient safety.
Yeah, and their mission statement is pretty clear. To enable and affirm the highest standards of healthcare quality and patient safety for all. That's quite an ambition.
It really is. And the scale is impressive, too, working in, over 70 countries? Accrediting or certifying more than 1,000 programs, that's a huge reach.
It is. And fundamentally, what they do is create these rigorous international standards. It gives hospitals and clinics a sort of yardstick, a way to measure themselves, see where the gaps are, and hopefully improve.
Right, like those international patient safety goals they mentioned.
Yeah.
Tackling specific problem areas.
Exactly. And the testimonials we saw suggest that going through JCI accreditation isn't just about ticking boxes. Hospitals apparently see it as a real team builder.
Oh, interesting. How so?
Well, it seems to improve coordination, communication between departments, breaks down those silos you sometimes get in big organizations.
Yeah, I can see that. And the sources listed other benefits too, didn't they? Like learning opportunities for the staff.
Right. And things like gaining a competitive advantage, which makes sense. Building community confidence is a big one, too.
Better risk management.
Better risk management, absolutely. And ultimately fostering a culture where patient safety is just front and center for everyone.
So it's meant to be more than just a badge. It's about changing how things are done internally.
That seems to be the goal, yes. Driving real improvements in care and safety.
Okay, and then focusing more nationally, at least within India, the sources also bring up NABH.
Yes, the National Accreditation Board for Hospitals and Healthcare Providers, NABH. It's part of the Quality Council of India.
And it serves a similar function to JCI, but specifically for India.
Pretty much, yeah. Setting up accreditation programs, establishing those national benchmarks, trying to, raise the bar for the whole industry and respond to what patients need and expect.
So you've got these bodies, JCI globally, NABH in India, setting the standards, high-level stuff. But then how do hospitals actually do it? How do they implement everything and manage the sheer complexity of running a healthcare facility?
Well, that's where the next piece of our source material comes in, introducing a company like Suprematic Consultancy. They're presented as a partner for hospital owners.
Right, helping them navigate all this. It looks like they offer support pretty much end to end.
Yeah, from the absolute beginning, like planning and designing the hospital.
Right.
All the way through construction, staffing it up, getting it running, and then crucially helping them achieve accreditation, specifically mentioning NABH support.
So really comprehensive. They mentioned working with everything from small nursing homes to big super specialty places.
And the list of services is pretty extensive. You've got the planning and design, obviously, recruiting doctors, nurses.
Essential.
Quality management system implementation is key. That ties directly back to NABH.
Okay. And then there's the operational side, too.
Oh, yeah. Deep into operations. Developing SOPs, those standard operating procedures.
The detailed how-to guides for everything.
Exactly. Analyzing how efficiently things are being used, like operating rooms or equipment. Restructuring departments if needed. Managing medical records. MRD management, they call it. Implementing the big hospital software systems, the HIS.
Wow, okay, so it's the processes, the systems.
And even the physical stuff. Sources say they handle procuring and setting up things like modular OTs.
Those prefab operating theaters.
Yeah. And medical gas pipelines, getting all the equipment, the furniture. It's like they handled the strategy and the nuts and bolts.
It sounds very integrated. And there was that interesting bit about their business model, too, right? Working with investors.
Helping strategize and execute new healthcare ventures, and sometimes taking an equity stake instead of just a fee.
So they become invested partners. That's different.
It is. And, looking at some of the blog titles mentioned from HospiMatch topics like financing, chronic disease, patient care trends, senior care, mental health, imaging tech, it just paints a picture of how incredibly broad and complex this whole healthcare world is that these support companies operate in.
Absolutely. Okay, so we've done the big picture standards. We've looked at the hospital level support.
Yeah.
Now let's shift gears completely and bring this right down to you, the listener. To that moment, you get your medical test results.
Right. And this is where that lifeline source comes in with some, frankly, very important advice. The core message. Let your doctor interpret the results.
Simple, but maybe harder to follow in practice, especially now with online portals.
Exactly. You see the report, maybe even before your doctor does, and it's full of medical terms, numbers, acronyms. It's so tempting to just start Googling.
The dreaded Google spiral.
Precisely. And that's where the problems start, according to the source. First off, you might misread normal variations, those reference ranges printed on the report. They aren't absolute.
What do you mean?
Well, they can vary from lab to lab. And they definitely vary based on your age, your sex, your overall health. Something flagged as high might be perfectly normal for you at this moment, maybe during pregnancy, or if you're recovering from an illness.
Okay, so context is key.
Huge. And then you might just overthink minor fluctuations. Some numbers bounce around a bit naturally. The source mentions things like white blood cells, vitamin D, cholesterol. A slight blip might look scary on paper, but be totally insignificant clinically.
Leading to unnecessary worry.
A lot of unnecessary worry.
Mm-hmm.
But maybe the biggest pitfall is missing the clinical correlation. That's what doctors do.
Connecting the dots.
Exactly. They don't just see the number. They see the number in the context of your symptoms, your history, the medications you're on, your lifestyle. That elevated ESR value example is great online. It might scream serious inflammation.
Right.
But your doctor might know it's just slightly up because you had a sniffle last week or you've been under a lot of stress. They see the whole picture.
Which you just don't get from Googling a single value.
Not at all. Google often leads straight to the worst case scenario. Panic sets in, you start self-diagnosing. It's really counterproductive.
Okay, so what is it that doctors are doing that makes their interpretation essential? We've touched on it, but let's break it down.
Well, first, as we said, that clinical correlation, connecting the report to your body, your history.
Okay.
Second, they look at trends. Is this a one-off result or is it part of a pattern? They compare it to your previous tests, if you have any. That adds a lot of meaning.
Right, a single snapshot versus a movie.
Good analogy. Yeah. Third, they have the expertise to know what's actually urgent. Which numbers mean call 911, which mean let's monitor this, and which mean don't worry about it. That judgment is crucial.
Makes sense.
And finally, they decide the next steps. Based on everything, they figure out what needs to happen, maybe just some lifestyle advice, maybe more tests, maybe a referral to a specialist. They turn that data into a plan.
Okay, so given all that, what should you do when that report pops up in your patient portal before your appointment?
The source gives some clear, practical advice here. First, it's okay to look, but try really hard not to jump to conclusions.
Look, but don't conclude. I like that.
Yeah. Note down anything flagged, maybe, but hold off on interpreting it yourself. Plan to talk it through calmly with your doctor.
Okay, step 1. What else?
Step 2, write down your questions. If something confuses you or worries you, jot it down. Take that list to your appointment. It's much more productive than, stewing over it alone.
Turns anxiety into action, sort of.
Exactly. And step 3 is a big one. Resist the urge to get interpretations from non-medical people.
Meaning don't text a picture of your blood work to your cousin who's a nurse or post it online.
Please don't. The source specifically mentions WhatsApp forwards. Don't do it. Friends and family, meanwhile, but half knowledge, especially about health, can be really misleading or even dangerous.
Right. Stick to the professionals.
Fundamentally, yes. Trust that your doctor has the training, the experience, and crucially, your specific context, history, symptoms, other results to understand what those numbers truly mean for you.
Okay. So reflecting back on everything we've covered today, it's been quite a range. We started way up high with the global and national bodies like JCI and NABH setting quality standards.
Yeah, the big frameworks. Then we looked at companies like Supremedic that help hospitals actually meet those standards and manage their complex operations day to day.
And then we brought it right down to that very personal level, how you, the patient, should approach something like understanding your own test results. drawing on that Lifelines advice.
And you can really see the connection, right? All those high-level standards and operational efforts are ultimately aimed at improving the quality and safety of the care you receive personally.
Absolutely. And knowing how to interact with the system, like knowing when to rely on your doctor's interpretation of test results, is part of navigating that system safely and effectively yourself.
Which leads to maybe a final thought to leave with everyone. Consider how much of good healthcare relies on, well, trust. Trusting the expertise of professionals.
Also.
Well, trusting the systems and standards put in place by bodies like JCI and NABH. Trusting the hospitals and their partners to implement them correctly. And maybe most importantly for day-to-day experience, trusting your own doctor to interpret your health information accurately. That trust, in many ways, seems fundamental to getting the best possible outcomes, doesn't it?